Hello, my name is Kyle Stultz, and today I will be talking about a proposal of an integrated promotion strategy. The organization we will be taking a closer look at today will be Scripps Healthcare System, which is based out of San Diego, California. Health and wellness is one service that Scripps Health offers to its consumers. Some examples of this include cancer care, heart care, diabetes care, health behaviors such as smoking cessation, substance abuse, and maternal health. Another service that Scripps Health offers is health promotion programs. Some examples of these programs are Stopping Diabetes in Its Tracks, Healthy Living Program tackles chronic diseases, Reducing Childhood Obesity in the South Bay, Screening Athletes for Sudden Cardiac Arrest, and Walking to Support a Healthy Community. Some of the current promotional practices Scripps currently employs are community involvement and social media. Now let's take a closer look at community involvement. In fiscal year 2016, Scripps gave $396 million to community benefit programs, $24 million in charitable care, and offered several free or low-cost services such as support groups, screening for health indicators, youth programs, special education for pregnant women, patient advocacy services, and also provided a community clinic for those in need. Scripps is also very active in social media. They currently have large Facebook and Twitter accounts used to send their message to consumers. According to Berkowitz, 33% of these adolescent mothers searched for health information online every few weeks, and 27% received health information from Facebook, combined with 83% of parents using social media, with Facebook being the most heavily utilized. The use of social media can ultimately reach masses you could not reach in other forms of communication. At Scripps Healthcare, they appear to be using the BCG matrix strategy. The BCG matrix includes the use of cash cows, stars, dogs, and problem children. In the case of Scripps, they are always pushing to find new avenues of research in the healthcare industry. Their heavy monetary investment into a new cardiovascular research center, or cash cow, has definitely been looked at as an industry leading development but has yet to generate much revenue. Scripps also conducts Community Health Needs Assessments, or CHNAs, and corresponding joint implementation strategies for its licensed hospital facilities every 3 years. This comprehensive account of health needs in the community is designed for hospitals to plan their community benefit programs together with other local health care institutions, community-based organizations, and consumer groups. Don Stanziano, who is the Vice President of Marketing and Communication for Scripps Health, was quoted stating, "As healthcare payment models rapidly shift from volume to value and consumers become more engaged in their care, our approach to healthcare marketing must be heavily data-driven and highly personalized to the consumer. This acknowledges the current changes in the market as well as addresses the fact that Scripps is well aware things must change in order to stay competitive in today's healthcare system. The major strength of Scripps is their massive involvement in the community combined with their outreach programs. They also have a large social media presence via Facebook and Twitter to help spread their message they hope to portray to the community that they serve. Scripps has also been working on engaging and educating the large elderly population in the greater San Diego area. Some potential downfalls of Scripps are that they are heavily reliant on philanthropy to fund research. Some of their facilities are not quite as up to date as their competitors in the area, and the massive amount of free services offered. While offering free services to underserved areas is absolutely necessary in a large community, this service could be considered dogs solely due to their drain on organizational resources. According to Scripps, uncompensated care includes charity care, bad debt, Medi-Cal shortfalls, and Medicare shortfalls, which total $335 million for fiscal year 2017 alone. Scripts can greatly benefit with the utilization and integration of mobile-based apps. According to a recent study, the number of mobile health apps will increase by a rate of 25% a year for the foreseeable future, and combine this with the current 500 million consumers and healthcare providers who are expected to be using mobile health apps, the time is now to plan, develop, implement, and personalize a mobile health app. Modern healthcare also is predicting that half of the 3.4 billion mobile device users worldwide will download a health app, which is a massive number of potential consumers that can be exposed to Scripps' current products simply by implementing an app to the marketplace. This app, combined with the integration into the community that Scripps is currently involved with, will generate tremendous amounts of potential new consumers, while reinforcing to the existing consumers that Scripps' willingness to progress and evolve with current trends. Recent studies have shown that integration not only greatly benefits the patients it serves, but also benefits the providers who are also involved in the treatments of the patients. When healthcare professionals were surveyed, 86% believe that health apps will increase their knowledge of patients' conditions. 72% believe that health apps will encourage patients to take more responsibility for their health. 50% think that apps will increase the efficiency of patient treatments, and 46% believe they will improve their relationship with their patients. Healthcare professionals and patients also see the greatest benefit for helping patients with chronic diseases, with 76% believing mobile apps will help patients with these chronic diseases, such as diabetes and heart disease. The most interesting statistic this study found was that 96% of patients believe health apps will help to improve their quality of life. Mobile-based apps can also improve communication methods between patients and providers by facilitating the messages through the app itself. Mobile apps also are more convenient when scheduling appointments instead of having to navigate what can be a tediously complex call center to check on or schedule appointments. Text reminders are also an advantage of apps as they allow the patients to opt in to reminders if they would like to do so. According to Berkowitz, the goal of any successful promotional strategy effort for a healthcare organization is to ensure that a long-term relationship is maintained with the customer rather than just a one-time short-term interaction, and B, the right message is delivered to the correct audience. By engaging in building these long-term relationships, Scripps can gain customer loyalty, all but ensuring repeated business from the consumer due to these factors. Berkowitz also states, at the foundation of a good promotional strategy is the understanding of the components essential for effective communication. A sender and a receiver must be able to encode and decode, often in the midst of significant noise. Scripps overall does a good job communicating their mission and values to the community they serve. But by perfecting specific forms of communication, they can further their brand, extending their reach in the community while capturing a larger part of the market. Another benefit to integrated marketing is that integrated marketing campaign, or IMC, also boosts sales as senior marketers report an average revenue increase of 10% from integrated marketing efforts, a number that's only expected to increase exponentially. And most importantly, integrated campaigns are exactly what the public wants and craves from brands. Being able to successfully integrate offline and online marketing, Scripps could potentially gain massive amounts of consumers due to the expected growth rates from IMC campaigns. Technology is the way of the future in the market. If they do not change and plan accordingly, they could end up on the outside looking in, thinking what could have been at the end of the day. Studies have also shown 72% of consumers prefer integrated marketing campaigns when compared to traditional marketing, and it was also found media published on at least two different marketing platforms received 24% more engagement than media shared through just a single channel. With these preferences, it not only helps smaller businesses, but more specifically helps larger corporations such as Scripps build and maintain trust with their targeted markets. This concludes my presentation on a proposal of an integrated promotion strategy. Thank you.